Hi, Mr. and Mrs. Baker, welcome. Today we're going to talk about Ava's diagnosis of Pierre-Robin sequence and how it affects feeding. Understanding her condition with this can help us support her better and make mealtimes more enjoyable. As you guys know, Pierre-Robin sequence is a rare condition present at birth that is characterized by a sequence of developmental irregularities that mostly affect the jaw and mouth during fetal development in the womb. As you guys also know, it involves three main features. The first one is micrognathia, which is an underdeveloped jaw that leads to a smaller and lower jaw and chin. The second one is glossoptosis. This is when the tongue is displaced backward towards the throat. And the third is the cleft palate, which is when the roof of your mouth opens up because the tissue didn't fuse together in the womb. So let's break down these further and talk about how each of these three features of Pierre-Robin sequence affect Ava's feeding. So let's start with micrognathia. So Ava's small jaw limits the space in her mouth, making it difficult for her to chew and move around food and to get a lip seal to keep food in her mouth. So this can lead to longer meal times and fatigue while eating. So Ava may benefit from little breaks to ensure that she has enough time to eat without becoming overly fatigued. But it's important to find balance where the meal duration is long enough for her to consume adequate calories, but not so long so that she expends more energy than she takes in. Okay, so the next main feature is glossoptosis, that tongue being further positioned back in the mouth. So this makes it much more difficult for Ava to maneuver and crush food with her tongue and manipulate it so that she can create that chewed up food and swallow it. So this is a potential reason why she prefers liquids and purees, as they are much easier for her tongue to control and swallow. That third main feature is the cleft palate. And as we know, Ava had a cleft palate at birth, which was repaired at 9 months. However, we want to keep this in mind because a history of a cleft palate can cause difficulties with oral motor strength and coordination later on, which we see when she has difficulty controlling her tongue and her jaw and having the strength to create a bolus of age-appropriate textures. Now, this is also affecting her soft palate as well, making it inefficiently able to seal during a swallow and causing that nasal regurgitation, because when it can't seal, it's going up, out through the nasal cavity and out the nose. So we want to keep this all in mind when supporting Ava's feeding. It's also important to note that Pierre-Robin sequence affects breathing by causing an airway obstruction due to that small jaw and backward tongue position, which in turn can complicate swallowing as the tongue's abnormal position interferes with the normal passage of food and liquids. So, because of all these features, Ava has experienced feeding difficulties, particularly with nasal regurgitation, oral motor strength and coordination, and food aversions. I am now going to turn it over to Katie, who will provide some evidence-based treatment options that may benefit Ava, as well as some strategies that you can use at home to support Ava's feeding.
First, I want to discuss the SOS approach to feeding. The SOS approach, short for sequential oral sensory, is specifically designed for children with complex feeding difficulties like Ava. It looks at the whole child, not just what they eat, but why eating is so difficult for them. Because of her micrognathia, Ava's smaller jaw makes chewing and lip closure challenging, which can lead to fatigue and slower eating. The SOS approach allows her to take small steps at her own pace, with breaks built in to support her endurance during meals, helping her eat without becoming exhausted. With glossoptosis, Ava's tongue rests farther back, making it harder to manage and move food in her mouth. The SOS approach doesn't force her to chew or swallow before she's ready. Instead, it uses play-based activities to gradually improve her tongue control and oral motor coordination, especially important for learning to handle more textured foods over time. Due to her cleft palate repair, Ava may still experience oral motor weakness or nasal regurgitation during swallowing. The SOS approach incorporates strategies that strengthen these muscles and respects her sensory preferences, which helps reduce her food aversions and build confidence around eating. Now I would like to discuss one type of therapy that may also benefit Ava, which is sensory-based feeding therapy. Children like Ava, who have had early medical challenges such as a cleft palate repair, limited jaw mobility, and a repositioned tongue, often develop sensory-based feeding difficulties over time. Here's what that means and why therapy focused on sensory exploration and oral tolerance can be helpful for her. So, Ava's early experiences with feeding may have been uncomfortable or even distressing, especially if she was experiencing nasal regurgitation. Because of this, her brain may now associate certain textures, tastes, or even the act of eating itself with discomfort. Sensory-based therapy helps you gently rebuild positive associations with food through play, exploration, and graded exposure. Second, her structural differences, such as small jaw and tongue positioning, have limited her ability to experience a full range of textures. She naturally prefers liquids and purees because they are easier for her to manage. Sensory-based feeding therapy helps expand her comfort zone without pressure by gradually introducing new textures and allowing her to explore them with all her senses: touch, smell, sight, and eventually taste. Finally, sensory feeding therapy is child-led and developmentally appropriate. That means it meets Ava where she is, focusing on building trust, reducing anxiety, and encouraging her to interact with food in a way that feels safe and empowering. It's not about forcing bites, it's about helping her feel confident, in control, and curious during meal times. Finally, I just want to go over some brief strategies that may be beneficial for Ava at home. So, sitting up with proper support is important because of Ava's history with a small jaw and her tongue falling backwards, which can make it harder for her to coordinate a safe swallow. Proper upright positioning can help reduce the risk of aspiration, supports better tongue control, and makes it easier for her to breathe and swallow effectively, especially important given her structural challenges. So it's also important to encourage Ava to take small bites. Because of her cleft palate repair, Ava may still have some weakness in the soft palate, which can lead to nasal regurgitation during swallowing. So taking small sips helps manage the flow of liquid and gives her more control during each swallow, reducing the likelihood of liquid entering the nasal cavity. It's also a good idea to offer small bites. Ava's oral motor coordination is affected by her small jaw and limited tongue mobility. Smaller bites are easier for her to manage and manipulate with her tongue, helping her build confidence and prevent fatigue while still practicing important oral motor skills. The final strategy I would suggest is to make feeding fun and positive. Given Ava's medical history, it's likely that some of her feeding difficulties are tied to negative experiences or discomfort in the past. Creating a relaxed, playful mealtime environment helps reduce her anxiety and builds positive associations with food. Avoiding food or pressure also helps support autonomy and trust, which are both critical for long-term progress in
Children with Pierre-Robinson syndrome and pediatric feeding disorder alike share difficulties in feeding. Some warning signs that you may see include slow weight gain, coughing or choking on foods, difficulty eating certain textures, difficulty chewing, complete food refusal, choking in general, difficulty breathing while eating, arching their backs when feeding, as well as difficulty keeping food down, such as frequently spitting up or vomiting. They may choose to eat a limited variety of foods, and they may overstuff their mouths or spit out foods. Because of these difficulties in feeding, you should monitor children with pediatric feeding disorders diets closely. Another item you may want to watch for is weight loss. Weight loss can vary in the degree of concern. However, a typical cause for concern is weight loss in newborns that are greater than 12%, as well as in children when unintentional weight loss is greater than 5% from baseline. Meaning a 100-pound child that loses 5 pounds we would have feeding concerns with them. A 50-pound child who loses 2.5 pounds, we would have concerns. A 30-pound child, such as a toddler or a child that is Ava's age, even a 1.5-pound weight loss could be concerning, according to the American Academy of Pediatrics. Some professionals you can contact if your child is having difficulty feeding include an occupational therapist, a physical therapist, a physician or nurse, a registered dietitian, a developmental specialist, a social worker, or a lactation consultant.